am Dr. Tessah Lim, and I'm a board-certified dermatologist practicing here in the Philippines in the province of La Union. Today's topic is about acne. So, let's face it, acne is the most common skin condition encountered by doctors in their clinic. So, it commonly occurs in adolescents and in young adults. So, for the age group, it usually affects 80% of people aged 11 years old, so that's 11, up to 30 years old, that's 30. And then for moderate to severe acne, it occurs in 20% of the young people. So, acne may persist in around 64% of individuals. So, ibig sabihin, pwede siyang mas matagal. It can persist in their 20s and then 43% in their 30s. Okay, so what are the 4 main factors involved in the development of acne? So number 1 is the abnormality of the cornification process of the pilosebaceous unit. So the pilosebaceous unit is like the gland. And then next is increased sebum production. So you will notice that your skin is oily because mas madami yung sebum. And then the next one is Propionibacterium acnes proliferation. So the P. acnes is more in number. Okay, and then the last cause is inflammation, which is what you will see in your skin, which is red. And then, so what are the factors to face? So number 1, yeah, I'll just run you down on other factors that you should know that can trigger your acne. Stress. That's the first one, of course. If I know this for my patients during Christmas time, for example, it's like exam week, doon lalabas talaga yung acne breakouts nila. Okay, that's the first one, stress. Number 2, hormonal changes. Okay, so for certain patients, like with polycystic ovaries, they do tend to have more acne. The third one is diet. So what diet can trigger it? Sugary foods. Then the next one is changes in climate or weather. So if you live in a place where there are 4 seasons, you'll notice sometimes when your skin is very dry during the winter time, that's when the breakouts are harder to control, probably because the medications at the same time are irritating your skin already, because this weather is very dry, so your skin is dry already. That can cause sort of imbalance in your skin that's causing the acne. So it really varies. For us here in the Philippines, very hot weather naman, sometimes kapag sobrang init, yun din yun nati-trigger. It depends. Next is some hair and cosmetic products. So for this one, I remember when I would see patients during the time na super sikat si Justin Bieber. Not so long time naman. Yung hair niya was yung gano'n. Yung basta parang super nasa front, sa may forehead part. And then I would see a lot of patients who had that look. Yung look nila yung gano'n Justin Bieber look. So, they would go to me for their acne, and then I said it's because of your hair, kasi yung hair mo nasa forehead mo. So, all the papules, all the pustules were just here. So, if you change your style, mag-improve talaga. So, thank you, hindi na gusto yung ganong Justin Bieber look. I haven't seen as many patients anymore with forehead acne because next is some chemicals. So, there are certain products again that you can apply in your skin that can trigger an acne reaction. I suggest you consult a board-certified dermatologist to know what they are. And then some medications. Okay, so this I'll mention the most common one, which is steroid. If you're taking an oral steroid, so this one is for the bodybuilders or someone who has been prescribed an oral steroid by their primary care physician. I've seen reactions where they've had acne-form eruptions occur on their body. Those are the factors to consider that can trigger your acne. Classification of acne. It can be classified from mild, moderate, and severe. So it's self-explanatory. For mild, it's usually there's comedones. So the comedones is what we call blackheads and whiteheads, and some papules or pustules. When mas madami na, so when you have a lot more papules and pustules and nodules, that's when you have moderate acne na. And then when it's more severe is when the nodules coalesce, and then it's more extensive, meaning mas marami ng parte ng katawan yung affected, then we call it severe acne. So what are the targets and treatment that we can recommend patients? Number one is the topical treatment. So how does that work? The topical treatment will, number one, unblock the pores. So yung mga clogged na pores, tatanggalin niya yun, and then mababawasan din yung inflammation. So actually they're halos the same yung cause, but it usually just treats one or two of the mechanism of acne. Like I said before, there are 4 causes of acne. So for these treatments that I will mention, it usually can trigger 1 or 2 at the most. There's only one medication that can target all 4. So next is benzoyl peroxide. So how does that work? So benzoyl peroxide will kill microorganisms. So papatayin niya yung Propionibacterium acne. And then the next one is it reduces inflammation. So yung redness, mababawasan. However, you have to be wary of that one because it also depends on the concentration of your BPO, because the benzoyl peroxide can also cause irritation, which can sometimes trigger more inflammation or redness for your face. So just apply carefully, slowly, consult a board-certified dermatologist. Next is oral antibiotics. So again, we can prescribe oral antibiotics which can kill or lessen the bacteria and then reduce inflammation. So it's the same, either topical or oral antibiotic. That's how it works. But it depends, of course, with which type of topical antibiotic is prescribed to you by your dermatologist. Salicylic acid, it works by unblocking the pores. So, and it also reduces inflammation. So, similar yung mechanism niya with the topical retinoid. Azelaic acid unblocks the pores and kills microorganisms. So, next is hormones. The hormones works by reducing the sebum production. And then lastly, oral isotretinoin. This one is reserved for severe acne. So, kapag yung acne mo is hindi siya responsive sa medications, oral antibiotic along with the topical antibiotics and topical medications, and you're classified under severe acne na, ibig sabihin super dami talaga yung acne, nodules na dikit-dikit, extensive yung affected area, that's when we give oral isotretinoin. So which mechanism does it target? It targets all 4. So siya lang yung gamot na nandiyan. It unblocks the pores, it reduces oil production, it inhibits P-acne, and reduces inflammation. So for this, I would like to share, I do get patients, a couple of patients now and then would Google, and then they say they just want to get the isotretinoin. And I see them for the first time, I don't know their history, I know what they've been through or who their doctor was. And as a dermatologist, I have to educate them of the implications of this medication, not only for their acne. Of course, your acne will clear up once I give you the medication, but it has a lot of side effects. And you have to, number one, trust. Papasalamat ako they came to me as a board-certified PDS dermatologist, but at the same time, they should know what the side effects are. And you should ask your doctor what the side effects are, and if it will fit your lifestyle, if you can tolerate them, and you're not trying to get pregnant, of course, that you would be taking this medication. Yun. So, okay, next. So what is the acne treatment recommendations? Of course, it will depend on the severity of your acne. So if you have mild acne, moderate acne, or severe acne. So the gist of that is yung shorter way of understanding. Pag mild acne, we usually just recommend topical medications. So, topical antibiotic, topical retinoid, salicylic acid, a combination of this to control your acne. Next one is if you have moderate acne, we add an oral antibiotic along with the topical. So, it's not either or, it's usually plus. Okay? So, meron ka na pinapahid ng mga gamot, and then aside from that, you have to take the oral medication to see good results. And then the third one is when we already see the patient for a long time and is not responding to all the medications that we're prescribing the patient, and that's when you consider oral isotretinoin because it's severe, ayaw talaga mag-improve, oral isotretinoin. There's one is think long term. So acne lesions, they tend to return. So after you have finished your treatment, kasi usually pag sa start yan, pupunta sa'yo, the patient will come to me, then they're very eager, lahat ng procedures gagawin, lahat ng mga gamot, ipapahid, and then afterwards, medyo pag maganda na, they sort of slack off. So, hindi na masyadong bumili ng gamot or nagpapahid ng gamot, as I don't see them anymore. That's when you'll notice that the acne will come back. Okay, so you have to have a good maintenance treatment. Okay, so hindi lang siya yung initial treatment na ibibigay sa'yo ng doktor, ng dermatologist. You have to have good maintenance because that is the key actually of controlling acne, is to have good maintenance treatment. So, for the initial results, acne treatment takes around 4 to 6 weeks. So, you have to have realistic expectations. So, hindi siya porque, okay, I bought the medication and pinahid ko na siya, it's been a week, so why is it still improving? Because, of course, your skin needs time. It needs time to regenerate, to take all the medications that you've been applying before you would see the results. So, that usually takes 4 weeks to 6 weeks. Okay, so medyo matagal, so you really have to be patient. Personally, for my patients that I get to see, I keep them with, they have to apply like certain medications continuously so that controlled talaga yung acne. Because the acne starts with a comedone, which is the blackhead and whitehead. So we really have to control the root or where it comes from before you would see all the pustules, all the erythematous lesions come out. Yung talagang maintenance is a big part of the success of your treatment. Okay, so yeah, there, maintenance should be kept for about months to years, and it also depends on the severity and the age of the patient. So what else? Tips. So how soon will it work? Again, like I said, the medication will work mga 4 to 6 weeks. So mga isang buwan ka nagpapahid bago makita mo talaga yung improvement. And for best results, you would wait 12 weeks. So that's 4, 8, 9, 3 months. Mga 3 months bago makita talaga na maganda na yung face. So medication may sometimes cause slight reactions. So what are the reactions? It can cause dryness, burning, and tightness of the skin. Yung parang banat na banat yung skin mo because it's very drying. Medyo matapang yung mga gamot na for acne. So especially the onset, just start slowly. Yun talaga yung tip ko for those who are watching this. Start slowly. Some patients are very excited. So if they have a product, I don't have a sample here. Let me go for yung a jar. If you have a product, lalagay na lahat. If you have acne here, there, everywhere, lahat yan lalagyan nila one product nun sa jar or sa tube. Kada isa yan merong product. It will cause irritation, and when your skin is irritated, ultimately it will conform more acne. So para siyang counterproductive for you. So start slowly, dahan-dahan talaga. As well as the retinoids. Retinoids are very irritating. Topical antibiotics as well, like benzoyl peroxide, depending on the concentration, can literally dry out yung skin mo. So you have to be very careful in the application. You have to ask your dermatologist, paano ko ba ipapahid ito? Gano'ng karami? Yun. So that's where we come in as board-certified dermatologists, because we studied this. We've seen a lot of patients not only improve with the medication, we've seen patients experience the side effects with these medications because they're over-eager, talagang excited. Yun. And then next is, so this is expected as part of the action of the medication, ganun talaga kasi yung gamot, and continue treatment despite these effects. So, ayan. So, for intolerable side effects, so ibig sabihin talaga super hapdi na, super dry na yung skin mo, just stop it. So, for certain patients, I have them stop. Depends really. I have to check the skin. Is it super dry? So super dry, a week. If not naman, like a few days would do. And then, resume ulit. Okay, kasi medyo napipigla, di ba? Parang ayaw nila, sobrang dry, sakit na. Ayaw na nila kung mag-continue. They sort of, just want different medication altogether. But, you you really have to be patient, and when you're patient, you will really see the results. Ang ganda talaga ng effect. And then, okay, just in case na super dry na, you can apply a non-comedogenic moisturizer to relieve the skin dryness. So, you choose a very good one. You ask your dermatologist which one they have. I'm sure board-certified dermatologists will have a lot of options for you depending on your preference, your budget, or if you apply makeup afterwards or whatever. So your daily treatment ritual. So okay, so this is just like the steps that we go through when you're already applying the medications. For the daily treatment ritual for patients with acne, number 1 is you have to gently remove the surface oil. So you cleanse your face. Yun yung unang-unang gagawin. Maghugas ng mukha. And then, so the purpose of that, of course, we know, is to remove the dirt, the oil, and the bacteria. Number 2 is you treat. When you treat according to your doctor's recommendation. Your doctor's recommendation kami yun. So, kung yung prescribe na gamot, ipahid. Kung meron nireseta na gamot, inumin. Kung meron mga sinabi na kailangan gawin. Kung iiwasan, huwag masyadong magpaaraw, huwag magpaaraw. So, you know, you just really have to follow the recommendations. Next, moisturize. Sometimes this is forgotten na kailangan pala mag-moisturize because you have to maintain the skin hydration. It has to have a normal barrier. Your skin has to be healthy, hindi siya over-dry para maganda yung what do you call this? It responds to the medication very well. Yeah. So maintain skin hydration for skin health, irritation relief, and proper discoloration. Next is protect. Okay. Many patients, they scrimp on this. Ayaw nila gumastos for the UV protection of sunscreen. You have to apply sunscreen every day. Not only for the wrinkles, if you're doing it kasi gusto mo bumata, hindi ka masyadong, you don't age as fast. Because it can also protect for the pigmentation because we're already treating the acne, diba? So, mawawala na yung mga pimples mo, magaganda na yung balat mo, magka-flat na lahat sila. But, you will cause post-inflammatory hyperpigmentation if you do not apply sunscreen. So, don't forget, apply your sunscreen. How much? This much. 2 finger length full for your face, for your neck. If meron pang natira, doon sa 2 finger length full, pwede mo palagay sa back ng hands mo or sa nape. I apply more. More is better than less. When it comes to sunscreen, apply a lot. Apply it often as you can. I live in a very sunny province in the Philippines, so I do practice sun protection with good sunscreen application, proper application, reapplication, understanding not only the sunscreen that you have to apply, you have to apply protective wear like a wide brim hat, umbrellas, do everything to protect your skin. It is an investment. Okay, so what are the do's? So this is the last part of the video. Wash gently on the morning and night. Okay, so don't overwash your face because I do, when I see certain patients, they have oily skin, diba? They tell me, Dr. can I wash my skin at lunchtime? Parang pag may break ako sa trabaho, gusto ko maghugas kasi oily na naman ang balat ko. Don't overwash your face kasi if you do, your skin will produce more sebum. Mas mag-oily ka, ano yung effect? Hindi mas magkaka-acne ka. So it's like, don't do that. Next is use a mild soap-free cleanser that does not disturb the skin's natural protective oil. So, yun. You need to find a balance with which cleanser you're going to use. So, consult a board-certified dermatologist. And then gently pat dry with a soft towel. Okay, of course, we all know that medyo self-explanatory na yun. Don't. What are the don'ts? So, ano yung iiwasan? Do not wash more than twice a day. So, I mentioned that na avoid alcohol-based cleansers which can irritate and aggravate acne. So, over the counter or in the groceries, department stores, you would see certain cleansers which is irritating. Consult a board-certified dermatologist. If you choose to purchase outside, which ones he or she would recommend for you. And do not rub. Okay, rubbing can cause hyperpigmentation, again, can irritate the skin, so just be gentle with your skin. To those who watch my video, thank you very much for taking the time to watch till the very end. Feel free to subscribe to my channel. Please subscribe to my channel. I would really love to see you here. And then you can hit the like button. You can also hit the notification bell. Feel free to comment down below if you want to ask me a question, or you want to say hi lang, Doktora, or just say anything you want about acne, you want to share your thoughts, your experience. I would love to hear from you. Until my next video, thank you and bye.